Welcome to the Erectile Dysfunction Radio podcast, where we tackle the facts, explore myths, and provide real solutions to help you take control of your sexual health and confidence. I am Mark Goldberg, certified sex therapist and host. For any men who are serious about resolving ED or other sexual challenges, we encourage you to visit our website, erectioniq.com, and use our additional resources. Reach out to us with any questions that you have, or schedule a 15-minute complimentary consult with us, with myself or any of my team members. We are passionate about helping men just like you, so please do not hesitate to reach us. Today we are joined by Dr. Petar Bajic. He is a board-certified urologist and expert in men's sexual health. He is the director of the Cleveland Clinic Center for Men's Health and is the chair of the SMSNA Young Clinicians Committee, and I happen to be a member of that. we are going to discuss the effects of Peyronie's disease on mental health, including body image and relationship concerns. So, Dr. Bajic, thank you very much for joining us.
Thank you so much for having me on.
Okay, so to get us started, can you just give our listeners a brief overview of Peyronie's disease and how it physically affects men?
Absolutely. So Peyronie's disease is a scarring condition of the penis that can affect up to 1 in 10 men at some point in their lives. It's essentially a genetic problem that affects the way we heal from microscopic injuries to the penis, or at least that's what we think it is. But what it causes is deformities of the erect penis. So most commonly we think of it as a penile curvature with a full erection. Now these are deformities that develop later in life. So if you have had a curvature your entire adult life, basically since you were a teenager, that's probably not Peyronie's disease. It's probably just what we call a congenital curvature, one that you're born with. But if you had kind of a penis that looked one way for most of your adult life, and then later on, maybe even after an injury, you notice a change in the shape of the erection, that's probably Peyronie's disease. And it's not just curvature, but it can be loss of length, it can be loss of girth, or a combination of any of those things. So this can lead to difficulty with, sex for men, for example, that are trying to have penetration. Sometimes it can make that more challenging. It can affect a guy's own self-image, just how he perceives that part of his body. So it's something that's relatively common, but I think under-recognized, underappreciated.
Okay, so I want to just stay for a moment on the difference between a congenital curvature and Peyronie's disease. And you mentioned it almost sounds like it's lifelong versus acquired. I know that's probably an oversimplification here. But could you speak to that? Because we do get a lot of questions about this, and I've seen a number of patients who have concerns about curvature in their penis, but a lot of them report it's always been like that.
Yeah. So there are two names for the type of curvature that you can have basically your whole life. Congenital curvature is one of them, and another one is chordee, Chordee. They basically mean the same thing. But what that is one side of the penis is just more stretchy than the other. So when you get a full erection and the penis, kind of is typically expands equally in length and girth. If one side of the penis is more stretchy, as the penis expands, it's going to kind of bow in a way where, it'll curve to one direction. Now, I say it's been there your whole life, but you don't really start to get full erections until you go through puberty. So most guys who recognize it during their kind of adolescent years. Okay, so usually anywhere from like 15 to early 20s, somewhere in that range. And that's when they reach peak sexual maturity, when the testosterone levels are the highest, the erections are the strongest, because a incomplete erection is unlikely to show the full degree of curvature. So a lot of people don't even realize that they have a little bit of a curvature. It kind of depends on what direction it is. You're usually looking at it from the top. So if it's a little bit up or a little bit down, that might not be apparent. And there's certainly nothing wrong with having a penis that's not perfectly straight. In fact, very few men have a perfectly straight penis. Most men have somewhere in the range of 10 to 20 degrees of curvature in one direction or another. But Interestingly, some men might not even notice unless they, let's say, they're having sex with a partner and they had kind of an ouch moment, even as a 18 or 19-year old, and they start looking really closely at an area that maybe they didn't pay as close of attention to. They say, "Oh my God, I have a curvature now," and they go online and read about penis curvature, and they say, "Oh my God, I have Peyronie's disease." Usually, in that age group, it's not Peyronie's. Peyronie's disease, guys when they're usually in their 50s, 60s, sometimes younger, um, it looked one way their whole life, and whether or not they had an injury that they recall, all of a sudden doesn't look the same. Okay.
Okay, that's really an important distinction, because we're gonna get into a little bit more about the distress that comes with these conditions, and I have seen men in different age range brackets just distressed by the curvature. They're not really concerned so much about what we call it, as much as just feeling a lot of distress at feeling like there's a deformity or something wrong with them. So we'll get a little bit more into that. So I guess to that end, in your experience, working with men who have Peyronie's disease or let's say curvature, pronounced curvature to some degree, what are some of the common emotional or mental challenges that these men are experiencing?
Yeah, I mean, I think that men can experience shame, that there's something disfiguring that's happened to them, or that their partner is going to be turned off by the appearance, or some men voice that they might feel like less of a man because maybe they've lost length in their penis as a result of the Peyronie's, which is essentially just scar tissue formation in the penis that restricts its stretchiness. Um, they might have decreased interest in sex or decreased desire as a result of this, because even getting an erection can remind them of what's going on. So there's a lot of different ways that this can affect men, and I think it does require a lot of kind of talking through it and helping them to understand what's going on, what the outlook is, what the outlook is for potential treatments. Really is all really important.
Okay, so one of the interesting phenomena I find when it comes to sexual health, the penis in particular, is that there are some conditions that people get and they think that it's medical and they're really worried and they're ruminating about it and they go in for testing, and the tests show that they're actually normal and healthy, and that information alone is enough to help calm a lot of the worry, concern, and anxiety. Okay? One of the things that, again, it's anecdotal, but in my experience in working with men with Peyronie's, is that information about, oh, there hasn't been any progression, it's not, the curvature is not as pronounced as you think it is, you may not even qualify for Peyronie's, doesn't seem to really alleviate that with a lot of the men that are noticing curvature and like feel this. Have you had that experience? And if so, how do you like talk men through this?
Yeah. I mean, I think this is obviously it's a very sensitive area of the body. It's not like I could just tell somebody that, oh, your cholesterol is supposed to be under X number and you're one over that, so it's probably fine, and makes them feel better about it. But there are all sorts of different guys out there. There are certainly some guys that come into my office that they just want to make sure they don't have cancer. That's their main goal. And when I explain to them what this condition is, that it has nothing to do with cancer, that it's not going to lead to any other health issue besides changing the shape of their penis, potentially changing the function, and also their own just perception of their penis. Some men are very reassured by that. But I also see some men who, even with the mildest, most minimal change in the shape of their penis, are just devastated. And I think it can be really hard to kind of unpack, what that's all about, why they're so distressed. So I try to, take a very kind of objective approach, kind of characterize what's going on. All of my Peyronie's patients who I see get a penile Doppler ultrasound, which is a test I do in the office where I examine the scar tissue using ultrasound to see if there's any calcification or bone formation in it, which can be useful in determining treatment options. It also allows me to use a medication to create an erection during that study so I can see the deformity in 3 dimensions. And then with the erection, we can actually measure blood flow, how much blood is flowing into the penis, and whether or not there's any blood leaking out of the penis. Because some men with Peyronie's disease can develop what's called venous leak, which is essentially a failure of some valves in the penis that are supposed to close to hold and trap the blood inside. So, in some ways, Peyronie's can actually contribute to erectile dysfunction. So by characterizing what's going on with the shape, with the blood flow, that's really what allows me to go through all the different treatment options that might be appropriate for that individual patient. And many times it can provide reassurance that the blood flow is normal, there's no calcification, the severity of the deformity is on the spectrum of this condition very much in the mild range. Sometimes just telling a guy that can be reassuring. But certainly there are some men who, even with the mildest deformities, 5 to 10 degrees, almost unmeasurable, can still be very bothered. And I think what I try to do and what our sex therapists try to do is really just like reframe the mindset around what's going on with this part of the body. I mean, uh, there's no like normal appearance of a penis. Everybody's penis looks different. They're like snowflakes. And I think that with porn culture and just like images of penises readily available, that guys think their penis is supposed to look like that. Like, that guy got a job because his penis looks a certain way or is a certain size or something. And, that's not necessarily what your penis needs to look like or should look like. But I think guys can really get in their head about it. So I think talking through that stuff can be a challenge, but in general, in my experience, guys can ultimately work through these issues and lead a perfectly normal sex life and have a very rewarding, experience.
Okay. How common is it? I mean, porn culture is obviously pervasive. It's something topic that we've covered from multiple angles and will continue to cover here on the podcast. But how have you seen that porn culture like impact the distress that men are experiencing about the shape of their penis, or concern that this will somehow be like a devastating blow to their relationship or to their sex life?
I'll be honest, I see it more in like the size concerns over the shape concerns. Like I've had guys come in my office that, their chief complaint is like that their penile size is they perceive as inadequate, and or that their erections are not getting hard enough or big enough. And we'll do an assessment and they're like 99th percentile for length, hardness, like everything. Sometimes it'll be like a guy 18, 20 years old, and that's just kind of like a sit down intervention moment where it's like, listen, man, like, you know, first of all, size is not everything, shape is not everything, but certainly there are guys out there who, you know, uh, based on a lot of reasons, might wish their penis was bigger, and like yours is like on the complete end of the spectrum. So I try not to make statements to my patients about like what a normal penis is supposed to look like and stuff, because obviously there's just you know it's just, I don't think, a concept that we should be promoting, that there's like a desirable appearance. But I think level setting people on like, okay, when we look at population,
Averages and norm, right?
oh sorry,
So you're saying like we look at like the averages of like what's like out there, and like we do talk about a normal range.
yeah, population based studies put the um, average penile length at somewhere like 13 centimeters to the tip of the penis, so 5.5 inches. So just when you like tell guys that, sometimes that can relieve some of the anxiety, just so they know
Yes.
where they stand. But I also try to just reemphasize it's not the most important factor, right?
Yes. Okay. So another question. So there are at least one product I'm aware of, but probably multiple versions of it, where there's like fillers that are available now on the market to address penile girth and whatnot. I'm wondering, is this, when you have like Peyronie's disease and you have curvature, is there like, do men ever request like wanting to fill in? Because sometimes that curvature comes with like indentation.
Mhm.
Do men ever request to like correct it with a filler? And is that indicated at all with Peyronie's disease?
So I would just stress that penile fillers are purely for cosmetic girth enhancement and are meant for guys that do not have like a medical condition of their penis. Okay. When it comes to Peyronie's disease, which, like I said, causes issues with curvature, length, and girth, there are a number of treatment options that are actually like, medical treatments for Peyronie's disease that can be used. And we can tailor that approach depending on what the goals of the patient are. So if they're primarily bothered by curvature, we have things like traction devices, injections, and surgeries that can seek to correct that curvature. If their main complaint is a loss of girth, whether it's just an indentation or maybe an hourglass shape, we have some treatments for that as well. There is a surgical procedure that we sometimes use for men that have indentation or hourglass called extratunical grafting, which is essentially laying some material underneath the skin to fill in that defect to restore the caliber. Some men, if they have a bad hourglass, will actually have buckling or instability of the penis during attempted penetration if they're trying to penetrate. And for that, we have different approaches where we'll actually go in and sometimes cut the scar tissue and release it and then sew in a patch called a graft. Sometimes we use penile implants in patients who have borderline or poor erections, who have Peyronie. So there's a lot of nuance to the different treatment options, but the injectable girth enhancing treatments are not really considered kind of like a standard treatment for Peyronie's. I know some people use it. I just don't think it's really an effective solution for those guys.
Okay, yeah, thank you for that because it's a newer product from my understanding. It's like a newer option available. You're saying it's purely cosmetic, and there would be other considerations long before that would be done. Now, is it a type of treatment that, let's say, I'll throw out just an idea here for a moment. A person has, let's say, a Peyronie's disease by diagnosis, but it's not progressing, and like it's really like in a wait and see, and they're really just distressed about the appearance side of things. Would they be a candidate, assuming that this is a safe treatment, which I am not, I'm not speaking to that at all, but assuming that it's a safe treatment and the patient wants to go ahead with it, is there a reason that they could not use something like a filler?
Um, I think that the techniques for administering penile fillers are designed for guys that do not have like a substantial penile deformity due to Peyronie's. So in general, for patients who have Peyronie's that they're bothered by, let's say, curvature, I would generally recommend addressing that and correcting that prior to considering any sort of, girth enhancing treatment. So it's not that it would necessarily lead to some major harm, but I think the cosmetic appearance, if you had a severe Peyronie's, shape change and then underwent cosmetic fillers, I don't think it would necessarily be what they were looking for. So in general, we would want to address any underlying Peyronie's changes that have happened, and then if they continue to have major concerns about, let's say, girth loss of the entire shaft, and they've been well counseled, and they're just really trying to get closer to how they used to be, then that would be one consideration.
Okay, I want to shift over to a little bit of a different topic, but sticking with the mental distress that oftentimes comes with Peyronie's disease. So, from a physiological standpoint, if a man has been cleared to engage in sexual activity, meaning that the curvature is of either a direction or an angle to which it does not preclude, let's say, penetrative sex or other forms of sexual activity, how common is it that your patients are reporting that sex feels different, it feels less pleasurable, and if that is a phenomenon that you are seeing, do you attribute that to a physiological change or to a psychological distress?
Great question. I mean, I think there's a lot to unpack there. First of all, the direction and severity of curvature might preclude certain positions. So if there's certain positions that they can't engage in that they normally like using, that might impact perceived sensation for one partner or the other. Maybe there's one partner, if it's a heterosexual couple, maybe the female partner likes a certain position they can no longer do. Okay, so then that partner might voice, you don't feel the same, or it's not, I'm not getting the same level of pleasure. Then there's the size changes component that can happen, and you can lose length and girth. And I've had some couples report that just from the size loss, that the feeling is different for the partner. But another aspect is the rigidity. So some may attribute, that it feels like you're smaller, but really the individual who has the Peyronies maybe is just not getting as erect. Maybe it's related to anxiety and just knowing the shape of the penis has changed, and now whereas the erection before was 100%, now it's 70%. It doesn't feel as large or as rigid. They could also have developed that venous leak that I mentioned, where blood's still pumping in great, but it's leaking out. So that's where that Doppler assessment and the in-office, erection test is helpful, just to kind of get a better understanding of what the underlying issue might be. But those are just some of the ways that it can impact the experience of intimacy, specifically penetration for couples.
Okay, so I just want to review that quickly. So you're saying sometimes couples have to adjust with position changes due to angle of curvature, direction of curvature. There also may be some actual physiological size changes that could be I would assume that's a retraction in length or in girth, to some degree, or you could have rigidity problems, stemming from either physiological blood flow issues like a venous leak, or it could be stress, anxiety, and whatnot. You're saying all these things are at play, but the phenomenon of feeling different could be very much physiologically based. I mean, there could be a decrease in blood flow. It could be that positional, what's called position restrictions with sexual activity. These are real, actual phenomenon that are occurring. This is not just a psychogenic phenomenon.
Correct. So likely some combination of the two. But I've also had a patient who had 100-degree upward curvature. I mean, more than a right angle. Who was still sexually active with his wife. They could do one position, and they were kind of fine with it. So we really, have to take into consideration the level of bother is probably the most important factor.
Yes. So to that end, how often is it? I don't know exactly how you work. I know some urologists encourage their patients to bring their partners in when it comes to sexual issues. Other urologists maybe don't have the luxury of being able to do that, just based on where they're working, etc. But how common is it that the partner is the one who's pushing for the treatment or is distressed by the Peyronie's disease? And how often or how common is it that the male who's experiencing Peyronie's disease is exponentially more distressed and more concerned than their counterpart?
Such a great question. To answer the first part of it, I always, always, always love for men that I see who are in a relationship that they bring their partner. I think that's so useful, just to make sure everybody's on the same page about the discussion. There's always some details that get filled in where you don't really get the full story unless you hear from both of them. And it also can help to unpack whether or not there might be any partner-related sexual dysfunction going on as well. So really, this is a couples condition for people that are in couples, and not all my patients are. Who is more bothered by it? Most of the patients I see in my practice are, cisgendered heterosexual males, and I will say that 99.9% of the time, the vast majority of the bother is on the male's side, and the female partners are usually there to be supportive. And once in a while they do voice some concerns related to things feeling differently for them, or position restrictions. They tend to be more bothered when the ED is also precluding sex, or if they care about penetration and they're not able to penetrate anymore. But it's almost always the guy that's like way more concerned about it, especially like in the milder cases where the partner may not even have noticed a difference.
Hmm.
Um, so being able to have that conversation with them together, I think, is really useful.
Yeah, I mean, that kind of goes along with like when we talk about so many different things like size and a lot of concerns like duration, or it seems like there is a vast discrepancy between what men are concerned about and what their partners are really focused on or are worried about in their own experience. And that's why, like, I really just appreciate your perspective on that, and really your experience in seeing this in your office. And 99+% of the time, I guess certainly would be more anecdotal evidence that men are stressing about these situations and conditions a lot more than their situations would seem to warrant.
Yeah, and I mean, you see these men in these couples, like there can be a lot to unpack. I mean, I see a fair number of older men, and some of them, their female partners may not want to have penetration because they have genital urinary syndrome of menopause, or maybe their lubrication is low, their libido is low. They're like, he wants to get an implant and have his Peyronie's corrected, but she's kind of like, I would rather not have penetration. So I would really try to work with these couples to kind of help enhance communication, help enhance getting them on the same page when feasible, and working with our colleagues in sex therapy to help have some of those conversations. But it's complicated, and every couple's needs are different. Every patient's needs are different. So we definitely want to tailor our approach for each individual patient, each individual couple.
Yes, and like that's so much of sex therapy and sexual function issues and whatnot does really revolve around like a couple. If somebody's in a relationship, like what each of them want is really really important. And I know that goes for so many areas of even like erectile dysfunction treatment and whatnot, where like sometimes it all makes sense in the guy's head and he thinks he's going to fix longstanding problems in the relationship if he can just get his erection correctly. And like lo and behold, his partner is really not interested in that at this point, and they've got other things to work out. So getting that like broader picture in terms of like what both partners want and getting those conversations started, I think is just so important. Um, okay, Dr. Bajic, is there like a take-home message that you would leave for our listeners when it comes to Peyronie's disease and like seeking treatment, but also like staying cool, calm, and collected through that process, and to be able to maximize intimacy and sexual activity when possible?
Yeah. So what I would emphasize is that this is a very common condition. And no matter how long it's been going on, no matter the severity, no matter if it just started or it's been going on for 10 years, there are ways that we can help. And that starts with having that conversation with a urologist or even with your primary care doctor to get the conversation started and get you to the right place where you can talk through some of these concerns. There's a lot of great treatments out there that we really would want to tailor to each individual patient. There's not a one size fits all approach. So definitely seek out somebody who's experienced with Peyronie's disease if you're interested in undergoing some kind of treatment. But also know that it's important to kind of have an understanding of like what's the spectrum of the condition and kind of where do you fall as an individual. How is it affecting your ability to function? How is it affecting your own self-image? And then talk through it with somebody who's experienced to know what your options are. And definitely be prepared for the possibility that if it's a very minimal change, that they might say, you know what, if I were in your shoes, I wouldn't do anything at all. Because sometimes the risks of treatment in certain cases may outweigh the benefits. So just, I can't emphasize enough the importance of reading about this stuff, educating yourself, talking to somebody who knows about it. There's support groups and stuff online. But it's definitely a very treatable issue. There's nothing that we can do to get you exactly 100% how your erections were when you were 20. If I could do that, I always tell my patients I'd be like retired on an island somewhere, multi-billionaire, because everybody would want that. But certainly we can help you achieve a perfectly normal sex life, perfectly normal, satisfactory experience with your own body, with your partner, etc.
Okay. I mean, I love that. I love that take-home message. And Dr. Bajic, once again, thank you so much for your time. We loved having you on this episode, and we cannot wait to get this out to our listeners.
Thank you so much for having me on. It's been a pleasure.